What happens in your body during a heart attack? A heart attack, medically known as a myocardial infarction, MI, is a life-threatening event that occurs when the blood flow to a part of the heart muscle is severely reduced or completely blocked. This blockage deprives the heart muscle of oxygen, leading to damage and death of the heart tissue. What is a heart attack? A heart attack is the result of a sudden interruption of blood supply to a portion of the heart. The heart, a muscular organ, requires a constant supply of oxygen-rich blood to function correctly. This blood is delivered through the coronary arteries. When one of these arteries becomes blocked, the section of the heart muscle it supplies begins to suffer from a lack of oxygen, a condition known as ischemia. If this lack of blood flow persists, the affected heart tissue, or myocardium, begins to die. This process of tissue death is what defines a myocardial infarction. The extent of the damage to the heart muscle depends on the size of the area supplied by the blocked artery and the time between the onset of the blockage and the restoration of blood flow. The consequences of a heart attack can range from mild, temporary chest pain to severe, irreversible heart damage, cardiac arrest, and even death. Who is at risk for a heart attack? While a heart attack can happen to anyone, certain factors significantly increase an individual's risk. These risk factors can be broadly categorized into modifiable and non-modifiable. Non-modifiable risk factors are those that cannot be changed and include advancing age, with the risk increasing for men over 45 and women over 55. A family history of heart disease, particularly a first-degree male relative who had a heart attack before age 55 or a first-degree female relative before age 65, also elevates the risk. Modifiable risk factors, on the other hand, are those that can be managed or controlled through lifestyle changes and medical treatment. These include high blood pressure, hypertension, high blood cholesterol levels, particularly elevated low-density lipoprotein, LDL, or bad cholesterol, and diabetes mellitus. Lifestyle choices such as smoking, a sedentary lifestyle, obesity, and a diet high in saturated fats, trans fats, and sodium also play a significant role in increasing the likelihood of a heart attack. When do heart attacks occur? Heart attacks can occur at any time, but research has identified certain patterns and triggers. There is a well-documented circadian rhythm to the incidence of heart attacks, with a higher frequency in the morning hours, shortly after waking up. This is thought to be due to a combination of factors, including the morning surge in blood pressure and heart rate, as well as increased levels of stress hormones like cortisol. Additionally, heart attacks can be triggered by intense physical exertion, especially in individuals who are not accustomed to regular exercise. Emotional stress, such as sudden anger, grief, or shock, can also act as a trigger by causing a rapid increase in heart rate and blood pressure, which can lead to the rupture of an atherosclerotic plaque. Other potential triggers include exposure to cold weather, which can constrict blood vessels, and certain medical procedures. It is important to note that while these triggers can precipitate a heart attack, the underlying cause is almost always pre-existing coronary artery disease. Where in the body do the effects manifest? The primary site of damage during a heart attack is the heart muscle itself. The specific location and extent of the damage depend on which coronary artery is blocked. However, the consequences of a heart attack are not confined to the heart. The heart's diminished pumping capacity can lead to a cascade of effects throughout the body. A common manifestation is chest pain, often described as a feeling of pressure, tightness, squeezing, or aching. This pain can radiate to other areas of the upper body, including the arms, particularly the left arm, jaw, neck, back, and stomach. This referred pain occurs because the nerves from the heart and these other areas send signals to the same region of the brain. Beyond pain, the body's response to the stress of a heart attack can lead to symptoms such as shortness of breath, as the damaged heart struggles to pump blood effectively, leading to fluid backup in the lungs. Other systemic effects include profuse sweating, nausea, vomiting, and lightheadedness or dizziness due to a drop in blood pressure and reduced blood flow to the brain. Why does a heart attack happen? The overwhelming majority of heart attacks are caused by coronary artery disease, CD, a condition characterized by the buildup of fatty deposits, cholesterol, and other substances in and on the artery walls. This buildup, known as plaque, can cause the arteries to narrow over time, a process called atherosclerosis. A heart attack typically occurs when a plaque deposit ruptures or breaks open. In response to this rupture, the body's clotting system is activated, and a blood clot or thrombus forms at the site of the rupture. If the clot is large enough, it can completely block the flow of blood through the artery. This sudden and complete blockage is what leads to a myocardial infarction. Less common causes of a heart attack include a spasm of a coronary artery, which can temporarily narrow the artery and restrict blood flow, and certain medical conditions or trauma that can damage the coronary arteries. How a heart attack progresses in the body. The progression of a heart attack within the body is a dynamic process that unfolds over minutes to hours. The initial event is the blockage of a coronary artery, which immediately cuts off the oxygen supply to a portion of the heart muscle. Within seconds, the affected heart cells switch from aerobic to anaerobic metabolism, a less efficient way of producing energy that also leads to the buildup of lactic acid. This can contribute to the sensation of chest pain. If the blood flow is not restored quickly, the heart cells begin to swell and their membranes become leaky. After about 20 to 40 minutes of severe ischemia, irreversible cell death or necrosis begins to occur. The damage spreads from the inner layer of the heart wall to the outer layer over several hours. During this time, the heart's electrical system can become unstable, leading to life-threatening arrhythmias such as ventricular fibrillation, which is a common cause of sudden cardiac death. The body also mounts an inflammatory response to the dying heart tissue, which can further contribute to the damage. The role of coronary arteries. The coronary arteries are the lifelines of the heart muscle. These blood vessels branch off from the aorta, the main artery leaving the heart, and encircle the heart, supplying it with the oxygen and nutrients it needs to function. There are two main coronary arteries, the left main coronary artery and the right coronary artery. The left main coronary artery quickly divides into two smaller arteries, the left anterior descending (LD) artery and the circumflex artery. The LD artery supplies blood to the front and bottom of the left ventricle, the heart's main pumping chamber. The circumflex artery supplies blood to the side and back of the left ventricle. The right coronary artery, RCA, supplies blood to the right ventricle, the right atrium, and the sinoatrial, SA, and atrioventricular, AV nodes, which are crucial for regulating the heart's rhythm. A blockage in any of these arteries will result in damage to the specific area of the heart muscle they supply. The severity of the heart attack is often related to which artery is blocked and where the blockage occurs. Symptoms of a myocardial infarction. Recognizing the symptoms of a myocardial infarction is critical for seeking prompt medical attention, which can significantly improve the chances of survival and minimize heart damage. While chest pain is the most common symptom, it is important to be aware of the wide range of potential symptoms, which can vary between individuals and particularly between men and women. The classic symptom is a persistent, crushing chest pain or discomfort that may feel like pressure, squeezing, fullness, or aching in the center of the chest. This pain may last for more than a few minutes or may go away and come back. Other common symptoms include pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Shortness of breath, with or without chest discomfort, is another key symptom. Other signs can include breaking out in a cold sweat, nausea or vomiting, and lightheadedness or sudden dizziness. Women are more likely than men to experience some of the other common symptoms, particularly shortness of breath, nausea/vomiting, and back or jaw pain. Long-term consequences and recovery. The long-term consequences of a heart attack depend on the extent of the damage to the heart muscle. The dead heart tissue is eventually replaced by scar tissue, which does not contract like healthy heart muscle. This can lead to a permanent reduction in the heart's pumping ability, a condition known as heart failure. Heart failure can cause symptoms such as shortness of breath, fatigue, and swelling in the legs and ankles. Other long-term complications can include an increased risk of future heart attacks, arrhythmias, and problems with the heart valves. Recovery from a heart attack is a gradual process that involves both physical and emotional healing. Cardiac rehabilitation is a crucial component of recovery and typically includes a medically supervised exercise program, education on heart-healthy living, and counseling to help manage stress and anxiety. Adhering to a heart-healthy lifestyle, including a balanced diet, regular exercise, smoking cessation, and managing blood pressure and cholesterol levels, is essential for preventing future cardiac events. Prevention and treatment of heart attacks. Preventing a heart attack is largely centered around managing the modifiable risk factors for coronary artery disease. This includes adopting a heart-healthy diet that is low in saturated and trans fats, cholesterol, and sodium, and rich in fruits, vegetables, whole grains, and lean proteins. Regular physical activity, aiming for at least 150 minutes of moderate-intensity aerobic exercise or 75 minutes of vigorous intensity exercise per week, is also crucial. Maintaining a healthy weight, quitting smoking, and limiting alcohol consumption are other important preventive measures. For individuals with high blood pressure, high cholesterol, or diabetes, medical management with medications is often necessary. The immediate treatment for a heart attack focuses on restoring blood flow to the affected area of the heart as quickly as possible. This may involve medications that dissolve blood clots, such as thrombolytics, or procedures like angioplasty, where a balloon is used to open the blocked artery, often followed by the placement of a stent to keep it open. In some cases, coronary artery bypass surgery may be necessary to reroute blood flow around the blocked artery. Please like, subscribe, and share.